While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog.
What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body podcast. Dopamine, mindset, focus. I brought in an expert to talk about these topics and more. Welcome to the show, Dr. Mike Van Thielen.
Thanks for having me, Tim. It's going to be fun.
Absolutely, absolutely. So tell us a little bit about the work that you've done, just like 30,000 foot overview in your career and what you focused on.
Yes, everybody can hear my accent. I grew up in Belgium, single mom, took care of me and my brother, didn't have much, but I went to the university over there, University of Brussels, did physical education, was very fun because I'm into sports, but what's that gonna bring you, right? So then I went into physical therapy, and that's how I came to the United States in 1997, because prior to that, I traveled with the Belgian Olympic swim team in preparation for the Olympic Games in Atlanta, saved $400, packed my backpack, came, lived the American dream. So that was 97. Needless to say, without any mentors or coaches, I got knocked down many times. So quickly, my motto became I never lose, I win or I learn. I had a lot of learning to do. Ended up doing physical therapy for a little bit, but got much more interested in a broader variety of health applications. So I went back to school for the College of Integrative Medicine, got my Doctor of Oriental Medicine license in acupuncture, board certified in Chinese medicine, homeopathy, you name it, and did that for 1 to 2 years and saw about 1,000 patients. But I got frustrated because these quote unquote alternative modalities, they were indeed less harmful than conventional medicine, meaning drugs, injections, and surgeries, but I really didn't get the lasting results that I was looking for either. So I had to go back to basics. I decided to get my Ph.D. in holistic nutrition, and I also started looking at Mother Nature and see what animals in the wild were doing in order to stay in optimal shape and health. And so by combining those two, I got very confident in helping anybody with their health-related problems. And so that's when I started writing books, started to do a lot of keynote speaking, and went from owning anti-aging clinics to being the CEO of a stem cell clinic to now being regarded as an expert biohacker. And today I'm a coach and mentor, helping people not only regain control of their health, but optimize their health and biohack, meaning objectively reverse their biological age, increasing their lifespan. I also help corporations and businesses and people on a personal level. So that was a quick overview there, Tim.
Hey, that's all right, Mike. We appreciate it. It sounds like you're very well versed. I look forward to reading your books. Tell us about the recent one or most recent one and what brought you to write about that.
Yeah, most of my books are obviously health related because of my background. But during the pandemic, a colleague of mine asked me to help out with pre-screening calls for people that wanted to qualify for medical marijuana. They were in a bind. They didn't have any other doctors to help. So I said, sure, I'll help out. And to my surprise, I talked to hundreds of people every week. And to me, it was mind-boggling how many people are suffering with anxiety, depression, PTSD, worry, fear, uncertainty, you name it, ADHD. And yes, there's drugs and therapies out there, but I really also find a common underlying problem, and that was a lot of people did not have a purpose in life. They're going with the motions day in, day out, wondering what tomorrow brings, next week brings, next month, next year brings. And if I put myself in that situation, and if I would be uncertain about tomorrow, next week, next month, next year, I probably would be worried too, and I would get anxious and depressed also at times. And so this latest book, I decided to get a little bit, not just talk about health and biohacking, which means upgrading your body, your mind, and life, but also go a little bit deeper into, in order to be successful, you need to have a passion, you need to have a purpose, you need to be organized in life, you need to be in control of your life. In other words, you gotta almost have a scripted life, having your goals, having your dreams planned out strategically, having the right people on your team to get to your highest potential. And when everything becomes clear, suddenly a lot of the stress falls away, and all of those medical conditions become much better because we're in charge, we're in control. And so my latest book, I have it here, called the IZOD Method. IZOD standing not for the clothing brand, but for In the Zone on Demand. And it's obviously about upgrading the body and the mind, but also about going a little bit further and deeper, which means, finding purpose, increasing productivity and focus, and freeing up valuable time, because a lot of us waste a lot of time on things that do not serve us on a daily basis.
Absolutely. And so we were talking off camera about dopamine.
Mhm.
So dopamine, it's one of the feel-good neurotransmitters we know. There's 5 dopamine receptors, but what you were saying about having purpose and being organized, if someone's dopamine deficient, it's going to be really hard for them to get organized, correct?
Yes. And, we see both, in dopamine is obviously the one that motivates us, that gets us in the zone, gets us in the focus. Like you said, it's the reward hormone. When our brain squirts a little dopamine, it feels good. It's like getting a pat on the back. So it stimulates us, right? But with my clients lately, especially since the pandemic, I kind of see the opposite. There's a dopamine overload, right? And what does that mean? Well, we have 5 intelligence hormones. We have dopamine, epinephrine, norepinephrine, acetylcholine, and serotonin. And if those hormones are in balance and at optimal range, that's when we're in the zone. That's when we, do our best work. That's when we win a race. And, most of us think that we get in the zone by accident, but there are ways for us to get in the zone on demand. And that's what the book is about, on how to do that, to turn that on and off. But back to the 5 intelligence hormones, if they're in balance and optimal, that's when we're in the zone. Now, when we're in a dopamine overload, meaning there's too much dopamine and we have an imbalance of those 5 intelligence hormones, what are the consequences of that? Well, that's when people say they're in a brain fog. They're unable to focus. The average attention span now is 6 seconds, right? So we already lost most of our listeners right now. We got brain fog, inattention, unable to focus, procrastinating, fidgeting, all that kind of stuff. And it's a vicious cycle. So the first thing I do with many of my clients that I feel are in the dopamine overload and they want to get out of their brain fog and they don't know how to focus and produce is educate them. Look, you're in a dopamine overload. So let's upgrade your diet, because of course dopamine is also released when we eat unhealthy, meaning sugary drinks, energy drinks, coffee, all that kind of stuff. It makes us feel good, right? Which is a dopamine release. So we got to upgrade that diet. And then we got to talk about social media, especially with our younger generations, because social media does the same thing. It squirts dopamine. Every time somebody likes a comment on our post or hearts our Instagram, it's an unconscious squirt of dopamine. It makes us feel good, so we seek more of it. And that's why we get addicted to social media and spend too much time on it. So first step is, yes, upgrading that, but also regaining control of that social media. So we're in control versus social media in control of us. And so when we get those hormones leveled and balanced, that's when we can eliminate distractions. That's when we get the job done. That's when we can avoid procrastination and things like that.
Yeah, that's very well said. I think it depends on how you want your dopamine served. At my gym, I literally see people who they're on a machine and they're in the middle of an exercise and they're scrolling. Like they can't even go one set of one exercise without their phone.
Without the phone.
And then, we won't get into the EMF thing, but, now, clothes producers are making, little slots to slide your phone in, and it's right by the genitals. I can't think of a worse idea in the history of the world. And, to your point about diet, if we're eating sugar, not only is it going to give that dopamine hit, it's going to create inflammation. And inflammation then lowers dopamine.
Yeah.
And I tell people it's like the Goldilocks effect. Too little dopamine, you get Parkinson's. Too much, you get schizophrenia.
That's right.
So, when we're chasing cheap dopamine, whether it's through social media, pornography, food that we shouldn't eat, how can we kind of reset or recalibrate our dopaminergic system?
Well, again, you're right. We got to identify if our client is in a dopamine overload or doesn't have enough dopamine, right? And so our diet and certain supplements and ingredients will promote the production of dopamine in our body, while other things will lower it. Like, again, I think most of us now have a dopamine overload because of the social media and, the poor diets that we are always looking for that sugar and those energy drinks that are basically depressants in the long run. They call them stimulants, but in reality, they're all depressants. They have a very short-term initial spike of energy, which is borrowed from the body. And that's why, obviously, we get into a depressive or a deficient state afterwards. And that's why we keep on using coffee or Red Bulls or those types of things. But they're basically all depressants. And so we need to just first, especially as healthcare professionals, identify, is my client in dopamine overload, or do we have a shortage of dopamine, and do we have to increase dopamine to increase that focus, or do we have to bring it down and balance our intelligence hormones?
Absolutely. And so, do you have particular tests, like an organic acids test, where you look at urine metabolites of neurotransmitters? Or do you have assessment questionnaires?
Yeah, I always start with a simple questionnaire, of course, and see what their day looks like, and ask questions how long they're on social media and what their diet consists of. And just by having a glance at it, we have the experience. We already have a good idea where they fall, overload or deficient, right? But if it's not so clear, or we're not sure, or there's contradictory information, then obviously we can do certain tests to assess the levels, and then implement certain strategies, and then reassess to see if whatever we are implementing is actually being effective.
Absolutely. And in terms of your work with athletes, so you started out doing more of the orthopedics and then acupuncture, and then now it's mostly nutrition and biohacking to help them get to the next level, correct?
Yes. Yes, in the beginning it was just nutrition and supplements and figuring out the best things when I was younger. Then again, we got into the stem cell therapy, regenerative medicine, became the CEO of a company, and we treated many top athletes, including NFL players, heavyweight champion boxers, and those type of athletes. And obviously, did stem cell application, shockwave therapy, all things to not only repair damaged tissue, because people think that's what stem cells or shockwaves do, but they do more than repairing. They actually renew and re-engineer. And what that means is that, and I'm a prime example, because while I was the CEO of the stem cell company, I was swimming in Minneapolis at the National Master Championships, and first 2 days I won everything, but then after my butterfly event, I pushed myself up in the middle of the pool to get out of the pool because I was too lazy to go under those lane ropes to the edge of the pool. And I felt something was wrong. Didn't think anything of it. The next morning I wake up and I couldn't lift my arms. I couldn't compete that last day. And so when I came home, an MRI showed 2 full thickness rotator cuff tears, supraspinatus and subscap, on the left and the right. Normally that's surgery, but obviously, I'm the CEO of a stem cell company, I'm going to do stem cells. So within 3 months, we saw the before and after ultrasound imaging. And not only were my rotator cuff tendons fully repaired, but they were much stronger, much more dense, much more resilient than they were before I injured them. And so that's basically what biohacking is. It's reversing your biological age, not just repairing, but also re-engineering and renewing. And so that's what, stem cells do. And so with many athletes, yes, where we repair, but also we renew and re-engineer, so they actually become stronger at their weaker points where they injured themselves. You could say it's cheating, but it's not on the doping list, and it's repairing tissues, but it does a little bit more than repairing, yes. And then so now it's biohacking. I do still work with top athletes, but I also work with the average John Doe that wants to either optimize their health or biohack or, reach their goals and dreams in business, whatever it may be. But with the athletes now, yes, and I think even in top sports, they could do so much more, but the coaches or the teams are not aware of it, because we really can reverse our biological age. I believe that today, and it's not just for the elite, this is available to everybody. We have the strategies and the technologies. We talked about technologies before we went live here. You have some great technologies yourself. We talked about on how they can reverse our biological age. So I believe today everybody can actually become 100 years old, but be able to do what a 40-year-old does, meaning go skiing, go hiking, go travel around the world. I think that is very realistic today if we implement the things that are available to us.
Absolutely, absolutely. And for the listeners, can you explain the difference between stem cells and exosomes?
Yeah, sure. Stem cells were initially regarded a very specific type of cells that was able to, number one, replicate themselves. In other words, make perfect copies of themselves as much as they wanted to, or differentiate into a very specific type of cell, whether that's a brain cell, a blood cell, a bone, a tendon, a ligament, a kidney cell, a pancreatic cell, a liver cell, it doesn't matter. But then more recent research shows that's not really what's happening. What really is happening is that the stem cells basically activate the necessary bioactive molecules necessary to repair and re-engineer a type of tissue. So yes, we need stem cells, but we also need other active molecules to really repair and re-engineer any damaged tissue. For example, our collagens type 1, 2, 3, our hyaluronic acid, our exosomes. So I'll explain the difference. Our cytokines, and all kinds of molecules that are necessary to get the job done properly. Because emphasis usually has been just on stem cells, and that's how clinics and stem cell clinics and doctors trying to sell the patient on the number of stem cells, but that's not the most important. We need to look at the quality of the stem cells and making sure that all the other biological components necessary for tissue engineering are available. So that's a stem cell. Now, what's an exosome? An exosome, basically, most exosomes are found in amniotic fluid, which is the fluid from the placenta. That's the highest bioavailable source of exosomes. And exosomes, you can look at, those are the tool bags. So the stem cell, I'm in Florida here, and when a hurricane comes by, there's all of roof damage. So this is a good analogy, I think, for the listeners. When your roof is damaged, the first thing we have to do is we probably have to call a repairman or a roofer. And that's basically the growth factors. The growth factors stimulate the process. They call, the stem cells or the roofer and say, hey, this is the address, we got a problem here, right? So we need growth factors to identify the problem. Then we need the stem cell to show up. But if the roofer shows up at your house and doesn't have his or her tools with him, is that roof going to be repaired? Probably not, right? So the exosomes is basically the tool bag. It's your Home Depot with all the RNA and the proteins and everything that is necessary or that we need to get the job done. So those are your exosomes, and they are much smaller than stem cells in general too. So in America today, exosomes are many times used as an IV too, because they don't have the potential of causing trouble, because some of the stem cells, they need to be filtered if you want to do an IV, because they may be too big and cause problems if you do an IV. But exosomes don't have that problem. They also cross the blood-brain barrier. So today exosomes are used to stimulate that whole process I'm talking about of repair and regeneration in the body, but also in the brain.
So let's talk about nutrition. How has your look and views on nutrition changed over the past 10 years?
Quite often, right? Quite often. But, I with a lot of research and talking to many experts in the field, there's, especially today, there's still this, big difference between people that really believe we need to eat fruits and vegetables and no meat. And then we have, especially now, the big carnivore advocates, because we're talking about the bone broths and the collagens, and we're talking about, ketosis and ketogenic diets. And so we still have that dichotomy here in experts. And a lot of my friends and colleagues that I talk with are very happy and feel good on a meat diet, but I'm quite the opposite. I never classify myself as a vegetarian or a vegan. I think it's a bad idea to classify yourself, because then you are restricted and you're probably not gonna keep up with being that person. So I call myself aware. I'm aware of what I eat. And so I almost never eat meat, but when I'm out with friends and I crave a filet, guess what? I'm gonna have a filet, right? But I do believe that in order to be in optimal health, it is the fruits, the vegetables, and limiting your meat intake in order to be in optimal health. And we can go in detail if you want to, but that's kind of my current stance, even though many people don't agree with that.
And what about athletes, who need to replenish their glycogen stores? Some people will say, well, once they are able to switch into more of a fat burning mode, they won't really require as much glycogen or glucose. What are your thoughts on that?
Well, there's the protein thing always has been a little bit exaggerated myth too, because we really need protein as humans as we develop. But once we're full grown as an adolescent, the amount of protein we need is really not that much, unless, like you said, we are breaking our body down by doing high intensity sports or gym workout or whatever it is that you do. And then we need to replace it. We need the building blocks, the essential amino acids, to rebuild and adapt, because hopefully we not just repair again, but we become stronger, right? Increased vascularization and strength, etc. So yes, but I still believe that protein, then those amino acids need to come from a plant-based source. So I still believe they need to come from those sources. And of course, we all agree, I think, that high quality supplements are important in today's society, where there's this toxic overload and the human being needs to somehow compensate. You mentioned electromagnetic radiation and frequencies, things that the human body normally can't deal with. And so it's an accumulation of toxins. And so by just eating organic, wholesome foods, it's the first step, but probably it's not enough to get all the essential nutrients on a daily basis and combat the free radical damage, the electromagnetic radiation, the systemic inflammation, and the DNA damage. So supplements become kind of an insurance policy, especially if you're an athlete. And so again, I myself and everybody of my clients, when we feel we need extra protein, it's going to be a protein shake, but it's going to be plant-based, coming from hemp and peas and all those types of chia seeds, sources of protein, because they have a much higher bioavailability than animal protein or whey or casein.
Talk to us a little bit about your work with the Boston Neuro Pain Center.
Yes, so when we talked a little bit about the pandemic and me talking to hundreds of patients, and we went to the direction of purpose of life, but a lot of those patients I was talking to for Boston Neuro Pain and Psych, again, anxiety, depression, ADHD, and you name it. And so many of those people are on medications, Ritalin, Wellbutrin, and Adderall. A lot of people are on Adderall. And so I had to educate myself a little bit more on these drugs. And obviously I found that Adderall, according to them, because I never took it, it does work. It does get them to focus, and they are increasing productivity. But if you look at the insert about side effects and adverse reactions, we're talking about increased heart rate, increased risk of heart disease, seizures, psychosis, the list goes on. So it's not something that I can stand behind. And so that's when I kind of start searching for what we call natural alternatives, because those drugs are called smart drugs. And the natural alternatives, meaning supplements that help with memory and focus and productivity, are called nootropics, right? So I started to look in nootropics, and like anything, there's many supplements out there. The majority really doesn't work well because the industry is not well controlled, but some of them are very effective. And so I stumbled upon a patented ingredient called biocitroid. Biocitroid is actually is a terpene coming from a specific type of blood orange or citrus fruit, if you will, from the southeast rainforest in Asia. And so biocitroid at 30 milligrams or higher is able to, again, pass the blood-brain barrier. So once you take it, within about 30 minutes, you feel the effects. Versus other supplements, usually you need to take them for several weeks in order to, feel a difference. So once this company that purchased the exclusive rights to biocitroid in the United States, the company is called Claritin Z Health. So I started working with them and decided that we needed to add a few synergistic ingredients to the biocitroid to make it a complete formula. So we added only 3 ingredients: L-tyrosine, as you know, an amino acid that helps with memory; phenylalanine, which is a neuroagent, again helps with short-term memory, focus, and those types of things. And then the third one, which to me is probably the most important one, phosphatidylate, which we all know as a healthy fat in our body and our brain. But phosphatidylate has been shown by scientific research to stimulate NGF, nerve growth factor, which means is we actually are stimulating the formation of new brain cells, stimulating neurotransmission and connections in the brain. So even from a Alzheimer, dementia perspective, or any other brain or disease in the brain like Parkinson's, etc., this would be a very effective ingredient, right? So by combining all those 4 ingredients, we now have a safe formula, all natural, plenty of research on all the individual ingredients, no jittery effects, no addiction as the Adderall poses, and 100% safe. And so this is something that I can recommend to my clients or my patients. And what it seems to do is it seems to work within 30-40 minutes and then last up to 6 hours. And it kind of helps people to focus, not easily distracted, and kind of get the job done. A lot of ADHD patients that are on those smart drugs like Ritalin and Adderall have been able to come on those drugs and get the help from a natural alternative without the side effects. And for other people, it just doesn't have the strong effects that the drugs do, and so they choose to stay with the drugs. So I'm not saying this helps for everybody, but it would be a safe alternative if it gets the same benefits than the drugs. But having said that, besides talking about a drug and an alternative, my goal is always to see, why are you not focused? Why are you labeled ADHD? Again, we got to sometimes go back to purpose in life, to getting organized, to basics, because many times it's like a student and it says, oh, I'm easily distracted. Okay, where do you do your homework? Oh, in the living room. Well, the brothers and the sisters, the dog, everybody's in the living room. Well, why don't we go back to basics and assign a designated workplace for you, whether that's at the office or whether it's the house. And once you have that workplace and you're going to work on homework or a project, whatever it may be, let everybody know not to disturb you. And then integrate techniques like the Pomodoro technique. And so what I'm trying to say, Dr. Jackson, is that there's many things that we can do at no cost to get organized and avoid many distractions, including this one. If we would just turn this off while we actually need to do work, it would be great, because this tool is very important for us. If we need to call somebody for information or we need to look something up, go ahead and use it. The problem is when we're working on a project and we don't need it ourselves, turn it off, because otherwise you allow other people to interrupt you for their benefit, right? And so there's hundreds of tips in my book that will actually help you get organized, get situated, eliminate distractions, use certain tips and strategies that may help you focus without the use of a drug or even a nootropic, right? And so ultimately, that's our goal, not be on any drug or nootropic, just being in control of our life and understanding how we can focus and what distracts us so we can control the situation.
Absolutely. I know when they studied the blue zone populations, one thing they found over and over again is that they all have a sense of purpose. And I'm not promoting that anyone smoke, but even, centenarians who smoke and drank alcohol, if they had a sense of purpose and strong social connections, they tend to live a long, long time.
No, that's exactly right. Most of us in this civilization in the United States, we're working for a boss. We're going through the motions, and we're just subject to somebody else's life or subject to being controlled by external factors. And we need to turn that around and get in control of our own life. A lot of misery will go away. A lot of stress will disappear. A lot of mental illnesses will go away, and they will be replaced by purpose, passion, and fulfillment. And so that's what we're trying to help people with.
How would you, I know you said you were born and grew up for a while in Belgium. How would you compare the culture there and sort of the ethos of the culture to what you see here in America?
Well, I've been here half my life now. I came here in 1997. I never really worked over there. Like I studied over there, and then I kind of pretty quickly came over here. Um, but America still has. I still would say I came here to live the American dream, and from a business point of view, it is much easier here if you want to be successful. There's a lot more red tape over there. Like if I want to start a lawn business tomorrow here in Merritt Island, where I am today, I just go to the city hall and get an occupational license, and then I go get to Home Depot, get my lawnmowers, and I'm in business basically the next day. That's something that would be impossible in Europe or in Belgium, right? So there's a lot more red tape over there from a business perspective. Otherwise, I think in the past, health and diets is a little bit better. Although when I go back home now, there's McDonald's also, and people get lazier, and those foods are cheaper than going shopping and cooking, right? And just like here, many families, both the husband and the wife, are working, and so then it becomes very difficult to coming home from work and go shopping and cook for the kids, and it is more money, so it becomes easy to go through the drive-through. So I see that trend taking off over there too, although in far less capacity than here. I think so also the governments are a little bit more concerned about their people, meaning when it comes to 5G, we talked about electromagnetic frequencies, when it comes to fluoride in our drinking water, and when it comes to certain ingredients in our food, the government is much stricter over there, which obviously benefits the people. And over here, they really don't care about us. It seems like they want to use every means to cause ill health on our people. So that's what I see the big difference.
Yeah, absolutely. I mean, over here, it seems like things get approved, chemicals get approved, medications get approved, and it may not even be the FDA approving it. It may be an industry expert, oftentimes one who works at the company who produces the product they're approving.
The
And
beneficiary themselves, yes.
yeah, it's the fox guarding the hen house, you know? And so, in terms of Wi-Fi, how much do you discuss that with athletes or clients in general? What do you do yourself to help mitigate some of the effects?
So my previous book was an Amazon bestseller, EMR, The Invisible Threat. See, so
Awesome.
this book is full of tips and strategies that anybody can implement at no cost or minimal cost. Sometimes you got to get a filter for dirty electricity for a few dollars and those types of things. So, but it's very affordable, and it's full of tips on what you can do to shield yourself. Because I believe that, again, I believe that all the cause of disease is toxemia. Toxemia literally means toxins in the blood, but in a little bit more detail, what it means is, as part of living, as part of daily metabolism, we obviously produce waste and toxins. But in a normally healthy organism, those toxins are eliminated by the skin, the kidneys, and the bowels, right? So no harm is done. However, when our body consumes or is exposed to far more toxins than it possibly can eliminate, then there's an accumulation of toxins in the blood and the body, and that's what we call toxemia. So now what does toxemia or those excess toxins in the body do? They do two things. Number one, these toxins basically steal an electron from a healthy atom, which then becomes unstable, which we all know as free radicals, causing damage on a cellular and DNA level. And this constant state of emergency, actually we have a fancy name for in conventional medicine. It's called systemic inflammation. You talked about it earlier. So it causes this constant state of emergency, systemic inflammation. And now even conventional medicine agrees that over 90% of all disease is directly correlated to the systemic inflammation. So toxemia is the cause of all disease. Now, how do we avoid all disease? Well, we need to keep toxemia in check. Theoretically, very easy, because what we need to do is we need to reduce the intake and exposure to toxins, which means man-made foods, man-made drinks, over-the-counter and prescription medications, polluted air, polluted water, household products, detergents, those types of things, beauty products that we put on our skin, electromagnetic frequency and radiation from our smart appliances, our laptop, our phones. Those are all toxins. We need to mitigate and reduce those while simultaneously increasing the nutrients that do what? Neutralize free radicals, fight systemic inflammation, and repair DNA. If we can do that and we keep toxemia in check, then we are basically bulletproof against any disease. And so, that's where electromagnetic frequency and radiation comes in, because it's an invisible threat. When we don't see it, hear it, or smell it, we don't think it exists. But for those who like science, just simply go to emf-portal.org/en, emf-portal.org/en for English. There's a compilation of thousands of research studies that basically agree now. There's a consensus that the non-ionizing radiation is indirectly affecting our health and our DNA. Because we always have been told that it's only ionizing radiation, such as from X-rays and gamma rays, is harmful and directly can split the bonds of our atoms and affect DNA. But now there's a consensus, no matter what the propaganda and your Google search bar says, a consensus that non-ionizing radiation from your smart devices, your cell phone, your TV, your radio, all those waves, that they also affect our DNA a little bit differently, not directly, indirectly. I can explain it if you want, because the radiation basically opens up the voltage-gated calcium channels that regulate the influx of calcium from outside to inside the cell. So the radiation basically opens it up. So now there's an excess influx of calcium inside the cell. So too much calcium. Now, what does that do? It increases superoxide and nitric oxide. And when they combine, they form peroxynitride. And peroxynitride breaks down in carbonyl-free radicals. And carbonyl-free radicals are really bad because they have a much longer half-life than your average free radical, right? So indirectly, it causes it. The problem is we're exposed to this radiation 24/7. An X-ray maybe once a year, right? This is 24/7. So it's much, much more harmful being in the house and having the smart appliances and having all those electromagnetic fields and the wireless and the routers and stuff going on. So the book really talks about all the things that we can do to, number one, inside the house is limit the exposure, all right, by grounding your computers and your laptops, by using a Faraday bag around your router, by identifying the electromagnetic fields in your house with an EMF meter, and the list goes on. Also, what you can do with your cell phone, right? Obviously on speakerphone, the inverse law of Newton says the further it is away from you, the exponentially less radiation that you get, right? When you're driving or walking, you don't want to make or receive calls because the radiation is exponentially higher, because it needs to continuously feed or search for that signal because you're moving, right? If you have low bars, you don't want to make a call because, again, if your bar is 1 versus 4 bars, it's exponentially 4 times more radiation to get that signal. And so there's hundreds and hundreds of things that we can be aware of and that we can implement to mitigate and shield ourselves, including an anti-aging bed cover that I've been sleeping on for 4 years. It's a grounded bed cover. I plug it in and you easily can, because some people think, oh, that's a gadget. No, I have a meter and I meet my radiation on my body in millivolts or volts. And when I place my hand on the mattress, it goes to 0 because now I'm in a close loop with Mother Earth. I'm discharging all excess energy into the ground while I'm sleeping 7-8 hours per day, right? So there's many things that we can do to mitigate the exposure to this electromagnetic frequency. And then, again, eliminate or mitigate toxemia, upgrading our diets, making sure our water is purified and clean, making sure we breathe in fresh air. So we really need to get that exposure and intake of toxins down while we learn what the nutrients are that help us with systemic inflammation, free radical damage, and repair our DNA.
Absolutely. Well, that's a very thorough answer. I'd love to hear the name of that mattress cover.
Yeah, it's called the anti-aging bed cover. If you, I don't sell any products, but I do have a shop here page on my website. My website is biohackingunlimited.com. And if you go to the shop here page, those are products and things that I personally use and recommend to my clients. And I believe you get a 10 or 20% discount if you go buy the anti-aging bed cover there. But that's our, you know, it's very affordable. You just put it over your bed. It's a bed cover and you plug it in. And so it shields you while you're sleeping and also discharges that excess energy that you build up during the day.
Are you familiar with the Magnetico pad?
Is that something similar, I assume? Is it a grounding
Well,
thing?
so it goes underneath your mattress. It's supposed to recreate not the Schumann resonance, but similar. So mine's
Yes.
10 Gauss, and I
Yes.
didn't know how that would work, if it would interfere.
Yeah, I think it would work similarly because I also have a PEMF device, which is also all the millions of Rife frequencies, right? So based on what you want to accomplish, whether it's boost your immune system, treat ovarian cancer, or, you know, Parkinson's disease, you just look up which is the frequencies and you dial into that frequency. So now we have a healing frequencies because we have man-made frequencies, which are usually detrimental to our health, and then we have healing frequencies, right? And so what we have been talking about is shielding ourselves from the man-made harmful frequencies that damage our body, and then also welcome natural frequencies that are in sync with our body that have healing properties, right? And so there are Tesla plasma devices out there. There are PEMF devices out there where you can dial in a certain frequency to assist our help with a certain ailment or condition.
What's something that you know today that you wish you would have known 10 to 12 years ago?
Ooh, so many things, right? It continues. I mean, I obviously test all those things and I try to, you know, utilize all the advantages that I know are safe and have a beneficial benefit. But as you know, even if you go to a biking congress and you go to all the hundreds of booths out there, half of them are probably, you know, BS, to say it nicely. So you need to kind of continue to do your research because everybody can get a booth. There's a lot of people out there to make money. And so we don't know which ones are just gadgets and which ones are for real. So what I usually do is I have a friend who used to be my R&D guy for the stem cell company. So I just usually collect all the information that I'm interested in. He does his due diligence and research online. Then he calls the company and asks for certificates or this or that, whatever he feels. And then he tells me this, yes, the research is backed up by research. Then if it's backed up by research, I order something and try it myself or try it or have a patient or a client try it that could benefit from it with a certain disease or ailments and let them decide whether or not it helped them. And if it passes those two criteria, then I start recommending it. But obviously a lot of products and gadgets and technologies kind of fail those two simple tests, you know.
Yeah. And it's unfortunate because it gives all of us a bad name.
Yes.
But you know, that's true in any industry, whether it's cars or houses, you know, you're going to have shysters.
Yes.
So you just have to do your due diligence. Well,
Correct.
thank you so much for being on the show. Thank you for the work that you're doing. And hopefully we can have you back on next year for an update.
Yeah, anytime, Dr. Tim. Thanks for having me. And thank you too. You're spending also your time and your efforts to share this information and help the world 1 minute at a time, right?
Thank you so much, Dr. Mike. Take care.
Take care.